My name's Simon Wilson. I'm a senior solicitor at Neil Hudgell Solicitors, and I deal specifically with surgical error claims. Many surgical errors are basic errors, really, but they can range from orthopaedic claims, such as the wrong setting of limbs, arms, legs, etc., up to damage during gallbladder procedures, during gynecological procedures, for example. The injuries that occur are more serious usually with surgical errors because by definition a patient is in having a serious operation anyway. Often, for example, they may be trying to do an operation keyhole, but an error occurs, and that then means that the operation has to be converted to an open procedure, which leaves the client with significant scarring both internally and externally, and often severe complications as a result. A common area of claims seems to be gallbladder claims, where unfortunately they are mainly done by keyhole, and it's very important that the anatomy is correctly identified before the operation is commenced. Often this isn't done, and there can be damage to the bile duct, which can cause significant ongoing problems for life for patients, and usually leads to open surgery as well. We've got over 20 years of experience of dealing with surgical error claims in all aspects of surgery, as mentioned, orthopaedic surgery, gynecological surgery. So it's really a question of experience that we know what we're looking for when we're assessing these claims. It's not just about how we deal with the claim, it's how the client is dealt with as well on an individual and personal basis. It's important that the client is involved in their claim, knows what's happening with their claim, and that things are explained properly to them. The claims can be quite scientific, quite technical. It's not always easy for a client to understand what is happening with their claim. Because of our experience, we're able to break that down for them really and explain in layman's terms what's happening so that they can understand the process. They should just give us a call on our free phone number, explain the circumstances. They will be put through to someone who deals with this type of claim regularly, so we'll know the right questions to ask, and that there is absolutely no obligation for them to proceed having called and had some advice. If they then decide they don't want to proceed, that's fine, but at least they're getting specialist advice as to what their options are.